I've been a nurse for 25 years. I currently work in the emergency room for a BJC hospital where we care for adults and children. I've worked through this entire pandemic and have done everything that they've wanted us to do, wearing all the PPE, following the rules, and then BJC came out with the mandate. I was devastated that I could possibly lose my job because of the mandate, because the amount of vaccine injuries that I have seen are astounding. We have had elderly people that are fully capable of caring for themselves, driving themselves to get their shot, and they have to be brought in by EMS, and they're just out of their mind. We've had to send many of them to neuro ICU for neurologic issues. I don't know what the closure was because they went down to Barnes Jewish down in the city. We have seen multiple strokes, multiple pulmonary embolisms, multiple other clotting issues, bleeding. We've even seen death within days, with the day of the shot, the first or second shot, to within weeks. Now, unfortunately, we're starting to see the children come in with the injuries. We are seeing the 12 and older that are allowed to get the vaccine coming in with chest pain, arrhythmias. We see so many young males. So when they tell you young males are getting myocarditis and arrhythmias, they are not lying. I just had a 20-something-year-old male in the other day who is in AFib now. That's very rare for a 20-something-year-old healthy, athletic male to go into AFib, and he was vaccinated. When we first started seeing these injuries, I asked that we put a tab in Epic, which is our charting system, so that we could track the people that were getting vaccines and their injuries. I was told by my management that that was too intrusive of a question. I asked people when their last bowel movement was, when is your last period, and multiple other intrusive questions. We need to make sure that we can add to the science and be able to extrapolate data down the line to say, this age and this age came in within so many days, they had this vaccine, whatnot. Now they've just a couple weeks ago put that in as an option, but now it's too late. When I triage patients, I will ask them if they've been vaccinated, when their symptoms started, and in the biggest, largest lettering I can in the triage note, I write that they've been vaccinated, and this didn't start until they were vaccinated. A lot of us were not willing in my emergency room. The majority of us are conservative, and we were not willing to get the vaccine. So our medical director of the ER said our vaccine rate in our department is one of the lowest in the BJC system. And we're like, well, why is that? He's like, because you stupid fucking conservatives won't get the shot. So I reported him. He did have to apologize to us. He did not apologize to me because he knows I'm very outspoken about the vaccine. We've had multiple discussions about injuries. I have witnessed him multiple times telling people that 100% this has nothing to do with the vaccine that you just received.
What's his name?
Dr. Fouts. He's with BJC. I know that I will eventually lose my job at BJC. I was blessed to get a religious exemption, but I've been a nurse too long to allow them to tell me what to do. I have been pulled in the office multiple times for advocating for patients. Most recently, I had a postpartum mother. She was about 8 days postpartum, and she was in there for, hypertensive issues after having her baby. So she happened to tell me that she was a nurse, and as nurses do, we start talking about where'd you work, blah, blah, blah. She said, I haven't pursued a job as a nurse practitioner yet because I was worried about having to get the vaccine being pregnant. I said, good choice, because we've had miscarriages that have come in. So I said, in my opinion, I would wait until you're done breastfeeding because we have had multiple infants in here who have become very ill once they have started breastfeeding from their newly vaccinated mother. One was an 8-week-old infant who was shipped down to the PICU at St. Louis Children's Hospital, and I have no idea what his outcome was, but he was very sick. So I told my manager, I'm just advocating for my patients and her 8-day-old baby. And if advocating for a patient is wrong, then I'm guilty. I have been a nurse too long to let COVID or the vaccine I told her I've been a nurse too long to let COVID or the vaccine stop me from being an advocate for my patients. I will always be an advocate for patients. I found out later that this patient had mentioned what I said to her to an OB nurse, who then called for me to be fired over it. I'm not sure what kind of world we're living in where other nurses are wanting to call for other nurses to be fired. Right, exactly. So that is pretty much my story as far as the vaccine goes. We're now we're soon going to be starting to have to test every week, which is going to be when they're going to have to fire me, because we have had multiple nurses and other staff members throughout the hospital who are fully vaccinated who have just been out with COVID. I've had COVID. I'm sure I have antibodies built up from having COVID. I don't wear all the PPE gear that they ask me to wear when I'm taking care of COVID patients because I don't think I need to. You know, I've worn a mask for the flu for 25 years. Why am I changing my practice now? I will tell you, too, that you hear on the news that COVID's really bad. 2 days ago, when I looked at our COVID tracking board, BJSee, Missouri and Illinois wide, only had 147 COVID patients admitted. Now, they have about 3,000 beds throughout their entire system, so that's not a lot of COVID patients. I have a sister who works at SSM, and she's in respiratory therapy, and she calls me every day she works to tell me about the vaccinated people that are fully, that have COVID that are getting intubated. So it is getting people sick or killing them. It's not keeping you from getting COVID, and we're admitting tons and tons of fully vaccinated people who are very, very ill and going on ventilators. And the ones that don't have the shot are doing better. Thank you.